High blood pressure, or what we call hypertension, is a condition where every time the heart pumps, it pumps out blood at a much more forceful pressure than it otherwise would.
Hypertension affects 1/3 of the adult population and is a major risk factor for many other diseases. It's known as a silent killer because it often occurs without any major symptoms or warning signs until a more serious problem arises.
Of all the things that age us, high blood pressure is the most important. Now that's stunning to most people, because who would think a little bit of extra blood pressure in your arteries would make a difference? Here's why it makes a difference. Your arteries are only designed to withstand a certain pressure.
Every time that heart beats, that wave of energy accelerates out of the heart and it just batters the blood vessels. And really what it comes down to is that battering is what tears them up. It tears up the lining of the vessels.
The damage to blood vessels as a result of hypertension can lead to a vast array of health crises, including atherosclerosis, or hardening of the arteries, which causes a decreased blood flow to the heart and the rest of the body. The damaged blood vessels, the increased blood pressure, and the decreased blood flow force your heart to pump harder to move your blood. The heart can become strained and enlarged, or patients can suffer angina, a heart attack, or heart failure. Hypertension can cause eye damage, including blindness, because the small vessels in the eyes can rupture or burst from the increased blood pressure. It's also the leading cause of chronic kidney disease and stroke.
After I was diagnosed with high blood pressure, the doctors were really concerned. You know, they told me, I remember an Army doctor looking me right in the eye and saying, "You could have a stroke today."
History of hypertension, high blood pressure?
Yes.
Getting your blood pressure checked regularly and keeping an eye on the levels are the first steps to avoiding more severe consequences. An optimal blood pressure reading is 120/80 or below. The first number measures the pressure in your arteries when your heart beats, called systolic pressure. The second number measures the pressure in your arteries between beats, or diastolic pressure. Doctors agree there is no good kind of high blood pressure, and even a few millimeters of mercury above normal greatly increases your risk for a more serious condition, like a stroke.
Hey, it's up there, Mr. Eugene. We just really want to get those numbers down. And it's a matter of just really making sure that they're dieting, exercising, and taking their medications, whether that's 1, 2, or 3 medicines.
These days, doctors often use a combination of medications tailored to the patient, and the medications have come a long way.
10, 15 years ago, you took a blood pressure pill, you were tired, you were fatigued, you got depressed, you couldn't function. That's not necessarily true today. Blood pressure pills today can treat blood pressure very well with minimal side effects.
Whether it's with the help of modern medicine, or through a healthy, low-salt diet and exercise, or a combination of all these approaches, treating and preventing high blood pressure is crucial.
If you have high blood pressure, make sure your blood pressure is treated. They call it the silent killer for a reason.
I learned that I've got to take care of this. And the best thing about it is that it's easy to take care of. Now that I have my high blood pressure controlled, there's no downsides. I can live my life completely without limits.